Well, I thank y'all for your patience and for joining us today for an important update regarding COVID-19 virus and how it's impacting Scurry County. We have representatives, although you can't see them, from Cogdell Memorial Hospital, Snyder Independent School District, and the Office of Emergency Management. I'm going to begin by introducing our panelists that we have on. We have Dr. Bid Cooper, who is our local health authority for Scurry County. We have Dr. Ryan Morris, who's the Chief of Staff for Cogdell Memorial Hospital. Kathy Goodwin, the Chief Nursing Officer for Cogdell Memorial Hospital. Dr. Eddie Bland, he is the Superintendent of Schools for Snyder ISD. I believe Nathan Hines is on. He's the Deputy for the Office of Emergency Management. And my name is Valerie Morris, and I'm the Public Information Officer for Snyder ISD. I'm going to turn this over to our representatives from Cogdell Memorial Hospital for an update.
I'm Dr. Cooper. I'll go first. Just numbers from the week of Sunday the 15th to Sunday the 22nd. We had about 100 positive cases. Approximately 10% of those had been vaccinated previously. In the last 2 days, on Sunday, we had 30 positive cases. A dozen of those were school age, 3 out of WTC. Yesterday, we had 18 positive cases. I don't have any breakdown about that. So obviously, we are in the midst of a surge, and it's accelerating, and it is a serious situation. There have been recommendations for booster shots for those individuals that have been fully vaccinated. For the Pfizer and Moderna, the recommendations are that if you are immunosuppressed from HIV infection, chemotherapy for cancer, chronic steroid usage, or on immunosuppressant medications for rheumatoid arthritis or psoriatic arthritis or ulcerative colitis or whatever, you are a candidate for a booster after your 2-dose series. And you have to have 28 days after your second dose. There's another category that doesn't necessarily fit into those specific types of patients. If you have multiple medical illnesses, diabetes, chronic kidney disease, heart disease, COPD, and the more of those, the worse. Contact your primary care provider, because you very well may be considered relatively immunocompromised and a candidate for a booster. For those individuals that have gotten the Johnson & Johnson, there is no recommendations from the CDC regarding booster in any situation. They just haven't made any recommendations regarding that. Coming as of September 20th, for those individuals that have fully vaccinated from the Pfizer and Moderna, anyone that wants a booster and it has been at least 8 months since their second dose is eligible. And that would be, just call your provider. I am pleading for everyone to get vaccinated. Vaccinations are available at the Cogdell Family Clinic on a daily basis upon request. They are all Pfizer for the most part at the moment, a few Moderna, but it's primarily Pfizer. And there's no doubt that vaccinations are the most important thing that we can do. If you don't want to go to our clinic and you have access to vaccinations through your pharmacy, that's just fine. Just please get vaccinated if at all possible. Regarding masking and social distancing, as health authority, I think that is of paramount importance. If you're not in your household, I recommend social distancing and masking in all situations. The current COVID that we're experiencing is more infectious than previously. It is more dangerous than previously. And as I said before, our numbers are increasing, and they're increasing dramatically. And it's affecting our hospital, your hospital. And I think that Dr. Morris can provide more information regarding their hospital stress.
The hospital has expanded capacity by reopening the COVID unit, which is in our old OB unit. We now have 12 beds dedicated for COVID patients. Those have been full completely on occasion. I think at the moment, this morning, I think we had 11. So the capacity is increased, and despite that, it is filling up. That is pretty much the case for area hospitals. We've been having trouble transferring patients. We've had critically ill people with numerous problems, not just COVID, but things like heart attacks that we have not been able to transfer. When we do get transfers, sometimes they're very far away. We've had people transferred to New Mexico and Colorado because those were the only beds available. Those have become even almost impossible to get. So it's affecting ICUs and access to critical care beyond just our local area. Children's hospitals are filling up with RSV and some other illnesses, so they don't have quite the capacity that they would normally have for COVID. They too are getting near capacity in their ICUs. It's becoming difficult to manage on multiple levels. We're keeping patients we would normally transfer. We're sending home patients that we would normally keep just because of capacity concerns. There's also issues with staffing. It doesn't make much sense to have more rooms if you are already short-staffed. So that has become an issue as everyone struggles to compete for staffing nationwide. So far, pharmacies, pharmaceutical supplies and PPE and things that we had a lot of problems with in the first round have not been as big of a problem. We have run into a bit of a wall getting testing and stuff done with the quickest turnaround tests that we have available. We've just simply gone through so many, but I think that the supply is a lot better than it was the first time around. So I expect a few small hiccups on things like that, but the bigger concern to me really is the kind of patients that we're seeing. It's relatively young people compared to the first round. This is not going through the nursing home wiping out the same population that we had before. That population is largely vaccinated, and the highest risk people for this disease, very many of them came and got vaccinated with the first round. What we're seeing now is more young people. We've had 20 and 30-year-olds hospitalized. We've had numerous 50 and 60-year-olds that are otherwise healthy that have been hospitalized. Some of them have passed away from this. And at the moment, I think we are up to 7 deaths from this virus in the past 3 weeks. Several of them otherwise healthy 50-year-olds. It's kind of heartbreaking to see when every one of them that I'm aware of has been unvaccinated, asking for the vaccine, and it's simply too late to do anything about it. We have had a couple of patients over the past few weeks hospitalized that were vaccinated. They went home quickly and their symptoms were not insignificant, but it was a different, just a different feeling and easier to take care of. They turn around easier. I know that won't necessarily always be the case, but there's no doubt in my mind that the vaccine seems to be doing exactly what it's supposed to do. I have people tell me that they refuse it for a variety of reasons. Had people tell me that their ministers have told them not to get vaccinated. They have conspiracy theories about all sorts of problems with the vaccine, and that's definitely not a perfect vaccine, but I think it's the best thing we've got. When people do get sick, they come into the hospital, they get numerous medications, antibody infusions, antiviral medicines, high dose steroids, often antibiotics, blood thinners. And, the risk of those is not to be diminished, that those all have potential side effects and other problems associated with them. And despite that, they don't necessarily always get well. So I think the risk needs to be, I think the public that's making a risk-based decision really needs to understand that this round of virus is much more contagious, that it's affecting younger people. I'm seeing a lot of kids that are sick. Fortunately, I haven't seen one of those hospitalized yet. 20-year-olds, 30-year-olds. And I don't think the close contact and the exposure link that we had with the first round is really going to apply equally to the second round. It's more contagious, and those contacts maybe don't have to be as often or as significant to possibly get the disease. So I would urge everyone again to go get one of the 2 RNA vaccines. And I'd also like to take a minute to point out that when you're getting an RNA vaccine, it's basically the blueprint for the spike protein, and you're getting that injected into your arm. If you go and inhale COVID, you're getting the RNA for the spike protein anyway in your lung. It's not a whole lot different. The only difference is when you get COVID, you're getting RNA for all the proteins, and that's enough to form an infection. So I have a few other statistics, I think, from the hospital's side, and I'll let Kathy give those.
Yes, this is Kathy Goodwin, Chief Nursing Officer at Cogdell. The last 2 weeks, the hospital inpatient census has increased greatly. We're averaging about 65% of our inpatients being COVID positive patients. So about 2 out of 3 patients that are in the hospital are positive for COVID. Currently, all of our hospital COVID rooms are full. At this point, if we had another patient, we would be putting more than 1 person in a COVID room with another COVID patient. This census and this percentage is higher than it has been at any other point since the coronavirus pandemic started, a year and a half ago. We've not been to this level of saturation. We have redeployed all the staff to meet the increased need. We've implemented crisis and contingency staffing, but we are still challenged with meeting the needs of the patients. Dr. Morris spoke about the young age of the patients we are seeing, and it's really true. Yesterday, we had 11 COVID inpatients. I ran the numbers on it. 82% of the patients were 55 or younger as of yesterday. Average age was 48. It ranged from 25 to 86 years old. So we're seeing young, otherwise healthy people really becoming ill. I want to give a little information on the vaccines that both Dr. Morris and Dr. Cooper spoke about, and encouraged everyone to seriously consider getting if you haven't. We do offer the vaccine in our clinic. You just have to come to the hospital between 8:30 and 4:30 on Monday through Friday, and we will get you the vaccine. Also, if you're interested in being tested for the coronavirus, you can call the clinic number. It's 573-1300. You can make an appointment, maybe for telehealth, it may be for inpatient, depending on your situation, if you're having symptoms. You can also call and get direct access testing set up, or you can just walk in and ask for it also. And that's where you don't have to see a provider. You pay $80 to get the COVID test done, and you just come into the lab and get that taken care of.
I think if it's okay, I'll take a second to answer a couple of these questions that I'm seeing. So why not give everyone in town hydroxychloroquine, zinc, and all the drugs to treat COVID rather than tell everyone to go home and treat it yourself before they need to be in the hospital? So there's been some scientific studies done on a lot of these things. And as we get more and more evidence, the evidence for a lot of these other things is really kind of weak. There's some evidence for things like vitamin D with specific regard to COVID, and getting adequate vitamin D is probably a reasonable choice. Some of the other things like zinc and hydroxychloroquine don't necessarily have good evidence enough to recommend them at this point. And some of them like, for example, the trend to take ivermectin has had some pretty significant consequences that can be negative. Hydroxychloroquine, especially if it's not taken carefully, may cause some heart arrhythmias and some other problems. So in the grand scheme of things, we're doing what the science says is best. I'd like to take a minute on the second vaccine, or the second question. Why are doctors getting 40,000? I guess they're meaning dollars from Blue Cross Blue Shield to get the vaccine. Seems like a moneymaker for the hospital to get the shot. There's all sorts of misinformation like this. I have no idea what this is about. I didn't get paid to get a vaccine, and I don't get paid to give it. The hospital, the vaccines are free. The government is subsidizing it. If anything, I'm paying taxes to pay for it. So it's just simply not true. I do get paid to take care of people in the hospital, and yet I'm asking them not to come to the hospital because I want them vaccinated and healthy. So I hope it's clear that my incentive here isn't really financial. So can a person's COVID test still read negative and still show signs of it? Should they get retested? Yes, absolutely. They can have a false negative test. People that have COVID-like symptoms should be in, should still be basically isolating themselves from others as per CDC guidelines in order to prevent complications in the event of a false negative. Wearing masks, social distancing, all those other things do make a difference.
Okay. This is Dr. Cooper, and I'll answer from Bennett. If you received the Pfizer vaccination, wait. No, let's go up to MTO. Got the J&J vaccine after 8 months. Can I get Pfizer or Moderna? And the answer to that is no. The CDC has not made any recommendation regarding what kind of a booster you can get after the J&J. They've made no comment regarding boosting with the J&J, and they specifically do not recommend the Pfizer or Moderna as a booster for the J&J. The technology of the two vaccinations is quite different, and they're not interchangeable in the least. Mr. Bennett or Miss Bennett, if you receive the Pfizer vaccine, should you get the same booster? The answer to that is yes, if at all possible. If for some reason you cannot get a booster from the Pfizer vaccination, but you can get a Moderna, it is okay. It's not ideal, but it's better than nothing. And it would go the same way if you had the Moderna first and you cannot, there's no way you can get a Moderna booster, but you can get a Pfizer. That can be an option.
I will say I saw this morning where Johnson & Johnson came out and said they think that boosters may be effective, but there's no guideline yet from the CDC or a timeline on whether or not that's going to happen. But I wouldn't be surprised if somewhere down the road that does become something that's recommended, but it's certainly not right now.
It has been in the news the last few days that both the cloth mask and blue mask are only 10% effective. I don't know where that information is coming from. The cloth mask, that may be true. I do not recommend a cloth mask. The surgical masks that we wear around the hospital are certainly more than 10% effective. They are not 100% effective, but when we're talking about a potentially lethal and deadly infection, I think a 50% protection is a lot better than nothing.
My way of looking at this is that everybody that gets sick from this virus has been part of a chain of infections passed from one person to another. And if you can stop it, even if it was only 10%, I think it would be worth using. That being said, we all saw almost no flu or other illnesses this year. I'm pretty convinced that that's largely a result of these isolation guide or recommendations that were being followed. And amongst hospital staff, we've been going into rooms with COVID and been around people that have been sick all year long with different types of masks. I think the recommendation to use masks is pretty strong, but I still think that the key to getting through with this is immunity, and in the long run, vaccines are going to be the most important thing you can do.
Next question from Jamie Abbott. Are you using the PCR test? We do not have that available locally. It can be obtained through Lubbock. The process is much more laborious, but it can be done, although we do not use it a great deal. Next one, the next easy. Would you recommend getting the vaccine for someone that's had COVID within the last 2 months and recovered? Yes. If you've been infected with the COVID, if you want a vaccine, you can get it as soon as you're out of quarantine from the infection.
There was a study that showed people with COVID previous infection antibody levels compared to people that were vaccinated, and then people that had been previously infected and had a vaccine. And those that were previously infected alone had lower levels than those that were vaccinated or both vaccinated and previously infected. So I think it's better to be vaccinated than to have gotten sick once.
The next question might be best answered by Dr. Bland. Says,
What's going to happen with schools?
Yes.
Yeah. Maybe somebody else should answer it. We're constantly monitoring the data. And, today is day 11 for us to be in school. We've got 34 students who've tested positive during that time. And Valerie, if I say this wrong, please tell me. And we've had 11 staff members who've tested positive during that time period. That's simple math on the staff. Our staff's testing about one a day positive. And looking at the numbers, I think our positivity rate for the testing we're doing at school is running, I think, very close to what the hospital's rate is at 20% positivity rate. We started providing free testing for staff last year through an initiative through the Texas Department of Emergency Management. This year we are expanding that to symptomatic students, being able to test them at school. It is purely optional from parents can choose to or not to be tested or not to be tested, and we're not going to do it without parent consent. But we do have it available. Our nurses are reporting back from all of our campuses on the number of students that they're seeing with COVID-like symptoms, not necessarily COVID, but be sick. And we have to go back to this same time period in 2019, because the start of the 2019-2020 school year was our last regular start up of a school year. And during the first 10 days of school that year, district-wide, we sent 8 students home with symptoms of fever, vomiting, or diarrhea. In the same time period this year, we have sent 100 students home. We know they didn't all have, we don't believe all those students had COVID. What we're saying is there's just a significant increase in the student illnesses that our nurses are seeing, and do believe that, yes, that it could be there's definitely a correlation to COVID, the COVID pandemic. We're having conversations now on long conversations today and starting that process. Today is day 11 of school. So some of our people that tested positive on day 1 and remained asymptomatic will be coming, and they're coming off are we going to that, I don't know, if going back to an old phrase, I guess, an old term, flattening the curve. Is our graph line going to flatten at this point, or is it going to continue to grow? And we don't know. We've had some questions about, is shutdown an option? I know there are some districts that have already shut down for 1 or 2 weeks, trying to mitigate the spread of COVID. I think before we made that decision, we will be having conversations with Dr. Cooper, Dr. Ryan, for recommendations. Anecdotally, I personally believe that when we had all of our protocols in place, our students and staff last year were probably safer at school than they were anywhere. it became a political issue in the last legislative session. And so the governor's executive order that removed the mask mandate, at this time, our district has chosen not to challenge that particular order. And with the mask mandate removed and the increased contagiousness of the virus, I've got a lot of concerns about what's going to happen at school. Currently, I know last year we offered virtual school as an option. Our state legislature removed that as an option this last spring. I know that they are in special session as we speak, and a virtual school option has been brought back to the table and passed out of the House Public Ed Committee, I believe yesterday, to go to the full House and then on to the Senate if it passes. But currently, we don't have a virtual option. So what does that mean for the school after all of that verbiage? What it means at the school is we're going to try to use as many preventative measures as we can. I encourage people to get vaccinated. Dr. Morris and I think Dr. Cooper hit on it earlier. I like to say that every choice we make in life is risk reward. If I eat that bowl of chili, is it going to give me indigestion? Well, that's a risk I may want to take because I really like chili. It's just whenever we start looking at vaccination versus not vaccination, the potential tragic consequence of not being vaccination could be loss of life, and that's a tough one. So I'm a big believer. I believe in freedom of choice. I would just hope people would make wise choices. And I've shared this with our staff. I'll share it with this group from a very personal experience. Excuse me. Well, I'm going to a funeral tomorrow to bury my brother-in-law that died of COVID-related pneumonia last Thursday, 48 years old, no other health conditions, perfectly healthy. And he had made the choice not to get vaccinated. And I think that's a really risky gamble to play. So I join with the doctor saying, please get vaccinated.
Thank you, Dr. Bland. I'd like to touch on a few of the questions that have come in about schools and then also what we're doing. And I'll echo the fact that we saw a significant decrease in infections last year with all of the precautions. Of course, we're a little limited on what we can enforce this year. So we are encouraging our students to wear masks and our staff to wear masks if they want to. We have seen that it has been effective, and we would encourage them to do so if they so choose. We're also trying to do physical distancing when possible without virtual school. We do have higher enrollment, and so that is more of a challenge than it was last year. Teaching our children good cough etiquette, respiratory etiquette, and promoting frequent hand washing. We're also pleading with parents to keep their kids home if they're sick. As Dr. Bland mentioned, we are seeing a much higher number of sick students that are coming to school this year than in years past. I want to talk a little bit about how we notify. That was one of the questions that came in if there's a positive case in school, and then also procedures for illnesses. So we ask that parents keep their kids home if they have COVID-19 symptoms, and that includes a fever of 100 degrees or more, sore throat, cough, body aches, vomiting, diarrhea. And they can't return to school unless they have their fever is gone without the use of fever-reducing medications. They can't come to school if their fever is being controlled with Tylenol or something like that. We've had some questions about doctor's notes. If a student is absent for more than 5 days, then we do require a note or a medical excuse explaining that absence. If they're just home because they have some other run-of-the-mill illness and they don't need to go to the doctor, they're able to recover at home, then a parent note is okay. But if we start getting past that 5 days, then that is when a note is required. Also, for COVID-19, and this is very straightforward, students or staff cannot come to school if they have tested positive or presumed to have COVID-19, and they can return 10 days after the positive test or symptom onset, fever-free with 24 hours and with their symptoms improved. Now, a lot of times when someone visits the doctor and gets their COVID-19 test, then they're provided with a note or return to school. That is a sufficient excuse for the school as far as attendance requirements. And if someone is exposed to COVID-19 and they have to be out for a quarantine period, then if the doctor wants to tag on to the note for the person that was exposed that they're requesting the whole family quarantine, we will accept that as a note as well. There's no need for somebody that is not experiencing symptoms, that has just been exposed to COVID, to necessarily go into the doctor just to get a note. We've been in communication with the family clinic and with the hospital because we are seeing they're seeing an influx of people coming in that maybe are just needing a note. And we want to make sure that we keep those visits open for people that are sick or needing medical care. We're not required at this point, or not allowed to keep a student from coming to school if they have had a close contact exposure. That is something that TEA has stated. But we always recommend that you follow your healthcare provider's advice or follow CDC guidelines. And really at this rate, with as many cases as we are seeing, we ask that everyone monitor for symptoms every day and consider that you probably have been exposed at some point with the rates that we're seeing. If we do know of an exposure, we are sending out a notice through ParentSquare to our families to let them know that a child has tested positive in their class. And so that's how we are notifying that they're tested. Let's see, I think I answered that question there. Of course, as you can imagine, with extracurriculars and especially at high school students going to lunch and things like that, it becomes very difficult to identify all of those students that might be a close contact, but we are doing our absolute best to track down anybody that might be. So,
Valerie, about that last question, what if the parent tests positive or has symptoms? What do they do with their children?
So that is a good question, and that kind of
Very good.
reiterates what I was mentioning earlier. TEA is not allowing us to exclude a student just because they're a close contact if they are not showing symptoms. So that is a personal decision for the parent as far as we can require for the school. So that's something that they need to think about, do the research, read through CDC's requirements, ask their family physician if they have a specific question or concern. But they do need, if they do decide to send their child to school and they have been exposed, we ask you to please monitor for symptoms. And if they are showing any symptoms at all, please keep them home.
And excuse me, it's Dr. Cooper. As I understand it, if a household has a positive case and the parents choose to keep their children home during the standard quarantine period, with a note from the doctor, I presume that is an excused absence.
Dr. Cooper, that's a great question, because the excused versus unexcused absence is kind of a misnomer. An absence is an absence. They don't get penalized for it. In fact, we encourage them to stay home. The only thing that we would have to go back and look at, if there's an extended number of absences, state requires a student to be in attendance 90% of the days that you're in school, that you're giving instruction. If not, then they have to go to an attendance review committee to make a decision on that student. So there's really not it's kind of a fallacy of excused versus unexcused. It's just an absence. And if you're sick, we expect you to stay home. We want you to stay home, and there's no penalty for it.
Right. And if and I would presume that the school system is not unhappy or would encourage the children of an infected household to stay home for a quarantine period.
Yes, we would. The state doesn't allow us to mandate that. We encourage people to take the safest route, and absolutely that would be the safest route.
Okay, simple question. Can children get the vaccines? 12 and up is the current. For Pfizer. For Pfizer, 12 and up for Pfizer. Moderna is still 16. And what should we do if a child in our kid's classroom is tested positive for COVID? It's an awkward situation. I don't see anything you can do other than monitor your child for symptoms and test if any develop. Unless I saw somewhere, yes, it's safe for a pregnant person to come deliver in our hospital, right, Dr. Mark?
Yes, everybody there will get typically tested when they come in. And we're even set up to deliver pregnant women that are COVID positive, but that hasn't happened since the last round so far. So they'll go through it's a different part of the hospital, and our COVID units and COVID rooms all have airflow handling so that it's vented to the outside and not through the whole hospital. So labor and delivery should be quite safe.
I saw a question from Reguera asking who should they contact about the stopping of the virtual school. That would be your state representative, Representative Dustin Burrows. You can get his contact information on the website. And our senator is Senator Charles Perry. You can easily find their contact information online. They're in session and they're having those conversations right now.
Let's see, Mr. Flores, I think he asked again, if you have ongoing symptoms despite being vaccinated, should you be retested? Yes, I'd test at least twice, 3 days apart, if I had ongoing symptoms to make sure. Another question, should we be doing the PCR versus the rapid antigen testing? Currently in our hospital, we do not have access to the PCR. The logistics and turnaround of getting PCR done as a routine would render that ineffective. There are false negatives with the rapid antigen testing. That's why with ongoing symptoms and a high index of suspicion, retesting is routinely recommended.
I would also add that there's several different types of tests out there. The antigen test that you may see at the drugstore that they, I believe, are doing at the school is a little bit different than the more rapid test that we do here, which is a nucleic acid antigen test. And it's a little bit more accurate, considerably more than the other one. But the most important thing here is probably the timing of the exam and the actual person that's collecting the specimen. So you could get a false negative on any of them, including a PCR, if it wasn't collected properly.
Dr. Cooper or Dr. Ryan, y'all may want to, because I think Valerie touched on this, but one of the questions says, should we get our children tested every time they exhibit cold symptoms, or only when they've been exposed to known positive cases? That's a question that's come up here a lot about. I know you guys don't want to get overrun with. I just need to know if my child has the COVID.
No.
When should they be tested?
Basically, there is no way to tell if an individual, child or adult, has COVID or not, based on their symptoms. And with the current level of infection and spread within the community, if anybody has any upper respiratory, or actually, if you recall, the 11 symptoms, diarrhea, nausea, there's a lot of, there's no way to tell, and yes, I recommend testing.
We've seen people that are testing positive with minimal symptoms that would look like a cold, but you have to realize that that person is still in a position to spread it and give someone else a potentially lethal virus. So fortunately, it's just the nature of the beast that's what we have to do.
I'm assuming what we're saying is if they have symptoms, you encourage them to be tested. If they don't have symptoms, don't bring them to be tested.
Unless they've had a close contact and you're just wanting to know. If you have a close contact and you're not going to quarantine along with the close contact, for example, in a household, it is prudent to get tested at 6 to 8 days after exposure.
There was a question about, is there an absent percentage for shutdown of schools? And if there is it campus-wide or district-wide? Those are questions that we're entertaining among ourselves right now to we've not drawn a line that said right now, this is the threshold. When we hit this threshold, that we're going to close down. If we're really wanting to watch the data now that we've been in school for 11 days over the next several days to see, do we flatten out, or if it's continuing to grow. And if it flattens out, I would say we're probably going to stay in school. If we continue to see growth, we'll be consulting with the county health to make a determination on what's the best track, what's the best, is closing the best option.
Thank you, Dr. Bland. I know we are running over our time here, but I do appreciate all the questions. And as long as we have some people asking some questions, are there any others that you all see in the Q&A that you would like to touch on that maybe we have missed?
Are most of the hospitalizations due to no vaccines? Yes, yes, and yes.
Here's one about children under 12 can't get a vaccine. Is there only protection isolation? No, you don't have to necessarily isolate. You can put a mask on the child. That's some benefit. Also, surrounding the child with people that are vaccinated decreases the chance that they will get an infection. So if their parents are vaccinated, their older siblings are vaccinated, other people around them, then the chance of them getting it would be less as well. And vaccines for kids are under investigation. When they are available, I don't know, but I anticipate that we will see some within the next year, but none right now.
And I do see a question about how do we get our child tested at school? So right now we do have a limited supply of tests. The nurses are testing children that are presenting with COVID symptoms while they are at school. And so if your child becomes ill at school and the nurse suspects that it could possibly be COVID, they will be contacting you. Of course, we have to have parent consent. We're not going to do this without a parent consent. And that form is available in Skyward. If you log into Skyward, it should actually pop up and ask you to complete that form if you are consenting to have your child tested for COVID if symptoms present and they feel like it's indicated and necessary to do so.
Okay.
Thank all of you for your time and your expertise and insight. I want to thank all the attendees as well. If we didn't get to your question, we will go through these, and I encourage you to please reach out to us if you have any questions. You can email questions at snyderisd.net if you have questions for the school. You can contact the hospital if you have questions there. You can visit their website to find contact information there. And we just humbly ask that you do everything you can to please help us slow the spread of this virus. And this concludes today's meeting. Thank you.
Get vaccinated.
Yes. Thank you very much.